Thank you for joining us, veterans, and welcome to the Madison VA Hospital's live Teletown Hall. And before I forget, happy birthday to the U.S. Air Force tomorrow and all of our airmen joining us today. My name is Jim Bove. I am Public Affairs Chief at the hospital, and I'll be moderating this afternoon's call. We have a panel of Madison VA's leadership team here to answer questions and to provide program updates. Today, we'll share information about several resources and services, so we highly encourage you to have a pen and paper close by so you can write them down. We'll provide information about upcoming events in Rockford and Madison, information about some prescription changes that may affect you, tips on how to get a quicker answer to your questions when you call us, an opportunity to provide us feedback after your appointments, harm reduction information, an update on flu and COVID vaccines, and of course, we'll give you an opportunity to ask questions at the end. We hope you stay on the line with us, and we encourage you to participate in the question and answer session at the end of the call. To ask a question, just press 0 on your phone, and you'll be connected with staff who will take your question and get you into the queue to speak with our panel during the Q&A session. We usually don't get to all of your questions, but you'll have the opportunity to leave us a voicemail at the end of the call so that we can follow up. If you get disconnected from the call, unfortunately, there is no way to rejoin, so please stay on the line. We'll also post this call on our website in its entirety within the next week or two. As always, we like to start our calls with a message from our hospital executive director, Ms. Christine Kleckner. Welcome, Christine.
Thanks, Jim. I hope everyone had a great summer. We were busy here with several projects and events. I do want to start by first thanking you for your patience. If you visited our hospital in Madison over the summer, you likely noticed and may have been impacted by the City of Madison's construction project that rerouted traffic in and out of the hospital. We are thankful the project was completed on time and all roads and traffic came back to normal activity. But thank you for your patience if you were impacted. Last month, we proudly inducted our newest member of our Hall of Heroes. While we typically host inductions around Memorial Day and Veterans Day, this one was a little different, because Lance Corporal Terry Christensen had originally been scheduled to be inducted last November, but he passed away a week before. So we were honored to have his family and friends here on August 8th for his official induction. Our next one will be in November, and look forward to announcing our next inductee soon. We also inducted our first full class of Purple Heart Hall of Honor inductees, which included from the Army, Sergeant William Hustad, Specialist Gary Johnson, and Private Warren Schuster. From the Marines, we inducted Lance Corporal Jacob Meinert, and from the Marines and Army National Guard, Sergeant First Class William Mays. Congratulations to all of our inductees. Looking forward to the next few weeks, I invite you to attend 2 events that we're hosting. As you'll hear shortly, we have an open house tomorrow at our Rockford Clinic from 11 a.m. to 2 p.m. That's Thursday, September 18th. And on Wednesday, October 22nd, we're hosting a breast cancer awareness event here at the main hospital campus in Madison from 10:30 a.m. to 12:30 p.m. So please wear your pink and stop by on October 22nd from 10:30 a.m. to 12:30 p.m. Lastly, we are very proud to share that we received a 5-star rating out of 5 as part of the Centers for Medicare and Medicaid Services 2025 Hospital Quality Rating. CMS's hospital ratings are based on 5 categories, which include mortality, safety of care, readmission, patient experience, and timely and effective care. A higher star rating out of 5 indicates better performance on these quality measures. We are proud to have been the only hospital in Madison to receive this rating. As always, thank you for your service and for allowing us to provide your health care. I look forward to seeing you at some of our upcoming events.
Thanks, Christine. You mentioned our open house in Rockford tomorrow, and here to tell us more is our Rockford Clinic Manager, Athena Pulowski.
Thanks, Jim, and thank you to all of our veterans and caregivers joining us today, especially those of you that we serve in our southern tier. which is Rockford, Janesville, and Freeport. For those in the Rockford area, I invite you to stop by our open house tomorrow. That's Thursday, September 18th from 11 to 2. We'll have brats on the grill ready for you. So whether you're a current patient or a new patient, stop by, grab a brat, say hi to our staff, and learn about the VA and local veteran resources. Please consider bringing a fellow vet with you, especially if they haven't been receiving their care with the VA. We always encourage vets to check their eligibility, and we will have eligibility staff on site at the open house. I cannot emphasize enough. Please don't wait until you need the VA health care before exploring your eligibility. The Rockford Clinic, which is the largest of the Southern Tier clinics, offers primary care, physical therapy, occupational therapy, radiology, lab services, X-ray, whole health, mental health, nutrition services, podiatry, and group sessions. In addition to all those services, we are also proud of the fact that we have a 97% trust score from our veterans here in Rockford. So share the trust with your fellow veterans and stop by tomorrow from 11 to 2 at the Rockford VA Clinic at 816 Featherstone Road. Thank you for allowing me to chat with you today, and thank you for entrusting us with your care, and most importantly, thank you for your service.
Thanks, Athena. We look forward to seeing you and your staff tomorrow, brats and all. Again, that's tomorrow, Rockford VA Clinic from 11 a.m. to 2 p.m., so be sure to stop by and say hello. Next, we've got a change about to occur for those of you who receive prescriptions from us and have one that you cut in half. If you have a tablet that you have to cut in half. Here to tell us more is Ryan Simonet from our pharmacy team.
Hello, everyone. I'm here today to share some news that may be very welcome for many of our veterans who receive medications from VA. Over the next year, Madison VA hospital and clinic patients that currently cut tablets in half will have their prescriptions changed to whole tablets if the medication strength is commercially available. For example, if you get 10 milligram tablets that you currently cut in half, you will now get 5 milligram tablets instead that you do not need to cut in half. Your daily dose will not change. If you have a half tablet prescription, you will be getting a postcard in the mail with more detailed information about moving away from half tablets. So be sure to look out for that postcard in the mail. So you're probably wondering how this change is going to happen. Over the next 12 months, when your provider writes a new prescription for your current half tablet medication, it will be changed to whole tablets. That means if you currently have refills on your half tablet prescription, it won't be converted until you run out of refills and your provider renews that prescription. Please, I cannot reinforce this enough. Please always read your prescription labels carefully to make sure that you take the right medicine and right dose. The last thing we want to happen during this change is for a veteran to accidentally take the wrong dose. Now, if you would like to convert to whole tablets sooner rather than waiting, you can contact the VA pharmacy. If you have a prescription where the half tablet strength is not commercially available, the prescription will stay as a half tablet. We have a list of effective medications on our website. If you have any questions about this upcoming change, please feel free to give the VA pharmacy a call. The number you can call is 888-478-8321. Again, that number is 888-478-8321. In the meantime, keep an eye out for that postcard coming in the mail in the coming weeks for those of you with half-tablet prescriptions. Thank you.
Thanks, Ryan, for that update. Again, that change will only affect those who currently have a prescription requiring a tablet to be cut in half. Next, we've got some helpful tips if you're calling us on the telephone that will hopefully speed up your response. Here to share more is Erica Sunby.
Hello. Thanks, Jim. I'd like to provide those of you who call us for telephone support a few tips to reach the desired service as quickly as possible. We all have the tendency to want to press 0 as soon as we're greeted by a phone tree. But if you do that, you may experience delays reaching the desired department, as you'll miss the opportunity to select a more quick
a more quick route to one of our core services. Most of these services are available 24 hours a day, 7 days a week, which we have not always been able to offer. When calling your VA medical center or community-based outpatient clinic, you will hear a greeting and a list of following core options. Press 1 for pharmacy. Select this option for your pharmacy-related needs. The pharmacy call center has certified pharmacy technicians and licensed pharmacists who can process medication refills, request medication renewals, and answer your medication questions. Press 2 for scheduling an appointment or to relay a message to your primary care, specialty care, or mental health team. The scheduling call center has trained medical support assistants available to schedule your appointments and relay messages to your care team. Press 3 to speak with clinical triage. Select this option if you are having new or worsening symptoms. This group of medical professionals will discuss new or worsening medical or mental health concerns and provide recommendations for healthcare needs. Based on your symptoms, this may include a virtual clinic visit with an emergency medicine physician by phone or video. Each month, roughly 1,000 veterans throughout our network receive care without ever having to step foot in a hospital or clinic. If you require assistance from a service not listed within the phone tree options, then press 0 to speak with a hospital operator, who will work with you to identify your needs and connect you to the appropriate VA service. Your call is always answered by VA professionals, and if they are unable to resolve your need over the phone, they will send a secure message about your concerns. If necessary, a member of your care team will call you back to discuss your care. We understand this may be a change in what you are used to, but it allows us to focus completely on you during your appointment and respect the time you've scheduled with us. It also puts staff in the best position to serve you. Clinical staff can focus on face-to-face appointments and keeping the clinic running smoothly and on time. Telephone staff can focus entirely on phone support, triage, and getting you scheduled with us.
Thanks, Erica. And thank you to our entire call center staff that answers many interesting calls throughout the day, I'm sure. And I just learned that they get roughly 115,000 calls a month. So I know they stay busy. Next, we want to hear from you after your appointments. Here to explain is our primary care dynamic duo of Erin and Randy.
Good afternoon, everyone. I'm Erin Mullen, Deputy Chief of Primary Care, and I'm here with
Randall Carter, Chief Nurse of Primary Care.
And we want to take a couple of minutes to talk about something that directly impacts how we care for you, our veterans, and how we continue to improve. The Sept survey, spelled SHEP. SHEP stands for the Survey of Healthcare Experiences of Patients. It's a confidential survey that many of you receive in the mail after a visit to one of our VA clinics. And while it may seem like just another form, it's actually one of the most powerful tools we have to understand your experience and make meaningful changes. Your feedback through SHEP tells us what we're doing well and where we need to do better. Whether it's how easy it was to get an appointment, how respectfully you were treated, or how clearly your provider explained your care, every response helps us see your experience through your eyes.
Thanks, Erin. We use this information to guide training, improve communication, and make system-wide changes. For example, if a veteran tells us they're waiting too long to be seen, we dig into that and work on solutions. If you say your provider listened carefully and explained things clearly, we celebrate that and share those best practices with our teams. So when you get that SHEP survey in the mail, I encourage you to take a few minutes to fill it out. Your voice matters. Please note that this survey may come several months after your appointment, so if you have information to share, we suggest that you write down notes about your experience so that you don't forget. It helps us honor our commitment to provide you with the best care possible, care that is veteran-centered, respectful, and responsive. Thank you for trusting us with your care, and thank you for helping us get better every day.
Thank you, Erin and Randy. Again, that SHEP survey may not show up for several months after your visit, so keep that feedback in mind for us. Next, we welcome Emma Bingen, our inpatient clinical pharmacy specialist, to talk about overdose awareness and recovery.
The harm reduction program at Madison VA began in 2023 and helps to provide veterans with education and supplies to enhance their safety. Harm reduction is broadly defined as a set of practical strategies aimed at reducing negative consequences associated with activities like substance use. It recognizes that veterans who are not ready to stop their use completely can still make positive changes to protect themselves and others. This judgment-free program helps increase access to services and products that increase safety and engagement for veterans who use substances and are eligible for care at VA. 5 examples of harm reduction resources include: 1. Naloxone, also known as Narcan, for emergency opioid reversal. Signs of potential opioid overdose would include slow breathing or ashen or bluish tinged skin color. 2. Fentanyl test strips that detect the presence of fentanyl in substances. Fentanyl is a strong opioid that is sometimes added to substances like heroin to make it more potent and addictive, but it also increases overdose risk if someone is not aware of its presence. 3. Sterile syringes that help reduce the risk of skin infections and transmission of HIV or hepatitis. 4. Sexual health screening and supplies to help enhance personal safety and prevent disease transmission. Substance use and sexual activity are both behaviors that can be made safer through harm reduction strategies. And 5. Referrals to social work, peer support, and mental health and substance use treatment when interested. We also hold a weekly harm reduction educational group over Veteran Video Connect, or VVC, that provides connections with other veterans working on their harm reduction goals. If you would like to hear more about harm reduction services or are interested in joining the weekly educational group, please call 608-280-7084 and ask for Teresa or Emma. That number again is 608-280-7084. Your primary care or mental health provider can also help you get connected with us. We want to meet veterans where you are at and help you move toward your personal health goals.
Thanks, Emma. That's all good information. If you don't need it, hopefully keep it in mind so that you can pass it along to your fellow veterans who may need it. One last update before we go into question and answers. We've been getting a lot of phone calls asking whether we have flu and COVID vaccines. We plan to have flu vaccines available for veterans at the main hospital in Madison beginning October 1st, so in roughly 2 weeks. They'll be available at any of your scheduled appointments for primary care or specialty care. There's no need for a special appointment or advance notice to get your free flu shot if you've already got another appointment. You can also walk into the hospital and get a flu vaccine in the lobby starting October 15th. And we'll be there Monday through Friday from 8 a.m. to 3 p.m. Again, flu vaccines will be available at your appointment starting October 1st, or you can walk into the hospital lobby beginning October 15th, Monday through Friday from 8 a.m. to 3 p.m. For our clinics, that's our folks who visit Rockford, Freeport, Janesville, Baraboo, Beaver Dam, Madison East, and Madison West. Vaccines will tentatively be available beginning October 15th by appointment. Please call your primary care clinic to get this scheduled. If you have an appointment already scheduled in one of our clinics, you can receive the flu vaccine at that appointment. The National VA website has detailed information about who is eligible for flu vaccines and where you can find no-cost flu shots near you. Visit www.prevention.gov/flu, FLU. Again, that website is www.prevention.va.gov/flu, FLU. For COVID vaccines, we have not received updated information about when these will be available at VA facilities, but until then, if you meet the criteria to receive the COVID vaccine, you can receive it in the community. With all of that being said, now it is time to move into the question and answer portion of our call. We have several questions in our queue, and we'll call your name when we are ready for your question. We can see your questions on our screen, but we'll ask you to repeat it so others can hear it, and then we'll respond. Please avoid disclosing personal health information. We want to make sure we protect all veterans' privacy as we answer your questions. So first up, did not provide a name, but they're calling from Sun Prairie. So if you're hearing that and you have a question about eye care in Sun Prairie, go ahead with your question.
Hello, this is Stephanie. I'm the Chief of Social Work. The veteran is, I guess, not on the phone, so I will repeat the question. The question is about eye exams in the community. He does not want to drive into Madison. How can he get a list of locations in Sun Prairie? So the answer to that question is really to first talk to your primary care provider and make sure that they put in a consult for an eye exam, and then the VA will determine if you meet the criteria to have that eye care provided in the community. If that's the case, then we'll work with you on getting a location where you can go. If you're not eligible for that, because maybe you're too close to the Madison VA, I would recommend that you call the social work office at 608-280-7085. That's 608-280-7085. And ask for your social worker to talk to you about whether or not there are transportation options available to drive you to that eye appointment so you can come down to Madison, because we want you to get your eye care. Thank you.
Thanks, Stephanie. I think we're coming right back to you here. We have a question from Robert in Madison. Robert in Madison, go ahead with your call. Robert Madison, are you with us? Well, we'll go ahead and read his too. And the screener did say he's in the hospital today on his birthday, so he might be in an appointment. So happy birthday to you, Robert.
Hi, Robert. This is Stephanie Schilling again, the Chief of Social Work. I'm sorry to hear that you're in the hospital on your birthday, but I don't know, maybe that gets you a special dessert or something. I'm not sure. No promises. But your question is that you need resources to help with a move, dealing with squatters, and getting a new place. Is there any help with moving trucks and such things? That's a really great question, and it's not an easy answer to say that, yes, there are resources out there. I do know the VA does not have staff that help veterans move, but our homeless program has made a lot of connections with different organizations. And so, again, what I would ask is, if you're in the hospital, ask the nurse to send your social worker up to the room, and we'll talk to you about it. If you're not, and you have want to call us on the phone, you can call us again at 608-280-7085. 608-280-7085. And we'll get a social worker to get a hold of you to talk about what options you might have, and maybe help you get over to the resources that you need. Thank you.
Thanks, Stephanie. Our next question is Willie in Rockford. Willie in Rockford, go ahead with your question.
I was concerned about the dental implant, and the dental, if it's not an implant, to complete a partial or a full plate. Which one would be feasible?
Hi, Willie. My name's Christy. I'm in the eligibility department here at the hospital. There is specific criteria for dental eligibility. I would suggest contacting our eligibility department so we can look at your file directly and assist you in giving you different resources for dental. Our direct number is 608-280-7038. Again, that's our eligibility department, and the number is 608-280-7038. And we can look up your file specifically and be able to give you correct resources for you, okay?
All right.
Thank you, Willie. Our next question is from Victoria. Victoria, you have a question for us. Go ahead.
Hello, yes, I'm actually a caregiver for my dad. He is in his 90s, not to give too much information. He needs more help in the home to keep him at home. And I know he was in the Korean War, and he did suffer, like, PTSD, etc. But how do I go about getting that actually diagnosed? In the past, he's been very meek about it, and he finally disclosed some information which adds up to me why he is the way he is and why I was brought up the way I was brought up. How do I go about doing that? And also, since my father is homebound and on palliative care at home, how do I go about that? Is it possible for him to get, like, diagnosed in the home or something, or via, what do you call it, teledoc or something?
Hi, Victoria.
Does that make any sense? Yeah.
It sure does, Victoria. It sounds like you have your hands full, and I just want to thank you for
It's hard.
For helping your dad out and sticking with him right now. You've got a lot of different things that you can check into, and so I think to start out with, I just want to make sure that your dad is getting primary care through the VA.
He is. Yep.
So you'll want to talk to his primary care provider to get some evaluations done that way for the different health concerns that he has. But secondly, I want you or him to call the social work office at 608-280-7085.
Okay.
Because we need to figure out your situation and hook you up with some programs that we have available. And that really is going to take a more detailed phone call between the two of you. So give social work a call, and we'll get a social worker to do an assessment and look at some of the different programs that we have available, including programs that might come into the home to really help you out so that your dad can stay where he wants to stay. And then thirdly,
the other quick question, though, is there support for me as a caregiver, like at the Rockford VA, or is there like a phone call thing, like a group thing for caregivers? Because I'm really stressed.
100%, and that's why we want to talk to you, because the social worker is going to get you hooked up with our caregiver support program, and we're going to get you services, we're going to get you some support, and then get some stuff for your dad. And then finally, your service-connected condition question, it's helpful to know that, I think you said you were in Illinois. You're going to want to go to the County Veterans Service office where your dad is located and have them help you with the benefit side of things and the service connection, because that's VBA, the Veterans Benefit Administration, and that's a whole separate silo from us. And so it would be helpful to have somebody who can advocate for you with them.
Oh,
so again,
thank you very much.
Please give social work a call, and we'll get you hooked up.
Okay, yep, he does have a social worker, but I've never asked about that, the help for myself. So yes, I will get a hold of her and leave a message.
Thank you so much.
Definitely.
Thank you, Victoria, and thank you again, like Stephanie said, for taking care of your dad, and please make sure you're taking care of yourself as well. Our next question is going to come from Ted in Janesville. Ted in Janesville, go ahead with your questions.
Okay, I had the question about being a guy that's wheelchair ridden, and you arranged for an appointment in Madison, and I thought maybe I could use the VA's bus, but you don't have a facility or an elevator on the bus for people with wheelchair problems. So I'm thinking the Rock County Transport people do a very, very good job and take you anywhere in Rock County, but they won't take me to Madison. And I guess I could use a van or something like that from Oak Park, but then if the VA has a bus, why don't they have the elevator on the bus to take care of people that are wheelchair ridden? And in addition to some of the other things you've been talking about, it's too bad you don't have a nice little booklet with a lot of these addresses and telephone numbers in it that we can look it up and call you when we need certain things. Thank you.
Hi, Ted. This is Stephanie again from social work. I feel like I'm getting all the questions, but that's okay. Thanks for the feedback about the transportation and the options that we have available through the Madison VA. I would encourage you to either hold on the line and give your name at the end, or call the social work office, and we can run through your options with you and just make sure that you're getting the resources and options. I'm glad to hear that you're hooked up with the Rock County Transportation. That's always a very helpful one. And then it sounds like Oak Park might be able to help you out. But give us a phone call in social work, and we'll look at all the other options and really work with our travel department and see if you're eligible for different services. That phone number, 608-280-7085.
Okay. I'll talk to the people here in Janesville, and we've done that already. I have an appointment for next Tuesday, a week from now, or into next week, and that's where the concern came, because the Rock County Transport people don't leave the county, and
exactly.
That I was looking for Oak Park will do it. It gets to be, it's sort of an expensive ride to hit your budget, and I want to work something out, and I would hope the VA would work something out with having a vehicle that would have an elevator on board that you could take care of people in a wheelchair. And I know there are people in Rockford that would like to go to Rockford there and might have a similar problem even within the city of Rockford. It's a very big area. I'm a lifelong Beloiter, and I kind of understand that because I did work in Rockford for a while, and I traveled a lot because I had other jobs along the line that did do that. And here I am now, a 55-year-old guy, and
Perfect.
I had a lot of problems. Thank you.
Yeah, thank you, and we'll help you out. Thank you.
Thanks, Ted. Our next question, we are going to Lake Mills. Mike in Lake Mills. Mike in Lake Mills, go ahead with your question.
Hi, yeah, I'm 100% disabled, and, I keep hearing that the VA is gearing more towards the veterans and taking money away from different places to make sure the veterans have the care they need. Well, I was sent out to community care for my teeth, and I had problems with a very badly cracked tooth, and my community care place put in for a crown, and I get denied. So I'm trying to figure out, when is this for the veterans care going to kick in, or am I going to have to beg and plead to get someone to take care of my teeth for me?
Hi, Mike.
Hi.
Stephanie again with social work. That doesn't sound right to me, Mike. And so what I want you to do is I want you to call the patient advocate's office. And somebody's going to have to give me that extension because that's not my department and I don't have it memorized.
We got you.
Well, unfortunately, I know that number very well.
Okay.
Thank you.
So Mike, call that number, and then also can you please leave your information at the end of the call so we can specifically look into your case? Because like I said, that doesn't really sound right to me, and so I think we need to look into the specifics and have our dental group. Maybe it was just a mistake, but thanks for the feedback, and we'll get to the bottom of it for you.
Okay,
thank you.
Thanks, Mike. Next up, we're going to David in Telmyra. David in Telmyra. Am I saying that correctly? Telmyra? David, go ahead with your question.
Yeah. How come it takes 6 to 9 months for the VA to come up with your problems, and it takes them that long for them to get your benefits here or whatever? Why does it take so long?
Hi, David. This is Liana Torres. I am the Chief of the Health Administration Services. Currently, we do not have a lot of information from the VBA. We do know that they have a little bit of a backlog with processing their claims. There is no timeline in the processing of those. You can contact them at 1-800-827-1000. That is 1-800-827-1000. I know there's a little bit of a wait time on that number. And then the other thing that you can do that I will strongly recommend is that you connect with the Veteran County Service Officer, and they can help you find out the status of your claim. They do have some access to the VBA system, and they're able to see the status of your claim, while we cannot see that. So if I were you, that would be the path that I will take. If you do not if you do not know the information of your Veteran County Service Officer, we will be glad to connect with you after the call.
What's that number again?
The number for the VBA is 1-800-827-1000.
Thank you, David. Next question, we're going to Beloit. Bruce in Beloit, go ahead with your question.
Yeah, this is Bruce in Beloit. I didn't say I had a question, but I guess you already answered my question about the COVID and COVID shot and the flu shot. I have an appointment October 10th for a pre-op physical. I was wondering if I can get that done at the same time frame.
Hi, Bruce. This is Athena with the VA in Janesville. At that time, yes, you'd be able to get your appointment, your shots at that appointment. Unfortunately, we will not have them available to the 15th of October. So if your pre-op is the 10th, the flu shot will not be available until the 15th. The COVID shot, though, you'd have to go to the community to get. So you can get those in the community at area around you.
I'll jump in. This is Ryan from Pharmacy. We just had an update today that we should have COVID vaccines the same time as the flu vaccine. So hopefully after the 15th as well.
Great.
That is hot off the press.
Hot off the press.
Breaking news.
Bruce. Hot off the press.
No.
So, unfortunately, on the 10th, they won't be available.
So you say on the 10th? On the 10th, they're available?
The 15th.
Oh, the 15th. Okay, but can I get that done at the Janesville clinic?
Yes, you can.
Okay. All right. That's all I have.
Thank you.
Thank you for the. Yep.
We look forward to seeing you.
Thanks, Bruce. Our next caller is unknown. So we don't have a name or a location, so we are going to go ahead and read that off ourselves. I think Stephanie Shocker, this one is for you.
Hi, this one sounds like me. The question or issue is the caller is wanting to know if there are any VA benefits or financial support available to him as the caregiver for his non-veteran wife with dementia. They live independently at home together. Okay, so this is a little bit different of a situation than the other caller's situation because you're the veteran, I'm guessing, and the non-veteran is the wife with dementia, and so would not necessarily be eligible for VA services for her. I would say that we still have caregiver support programs, and we have some educational offerings in general for caregivers, regardless of who they're taking care of. But the other thing I would really suggest that you do is I would suggest for your non-veteran wife who is a member of the community that you go and you talk to the aging department or the Alzheimer's Association in your location. And since I don't know where you're from, that's either Wisconsin or Illinois, I would guess. And both Wisconsin and Illinois, depending on what county you live in, they have aging and disability resource centers, and that's where the general public who aren't eligible for VA benefits go to get similar services in state or local funded programs. So the Department on Aging or the Aging and Disability Resource Center, it's easily found if you Google it, and so that's what I would encourage you to do. If you can't figure that out, please call the social work office and we will Google it for you and give you that number.
Thank you, Stephanie. Keeping you busy today.
Yep.
Next up, we are going to Roy in Apple River, Illinois. Roy in Apple River, Illinois, go ahead with your question.
Yes, I'm a 74-year-old vet that's having problems with pain management. I've got a problem with my neck, my shoulder, and my left arm. Went to see my provider. They give me medication, which does not work. They say that's all they can give me. I just want relief, even if it's just for one day. And I don't understand why they can't give it to people that need it.
Hi, Roy. This is Erin Mullen, the Deputy Chief of Primary Care. I'm sorry to hear about your experience. There are frequently kind of communication barriers between patients when they're coming in to talk with the providers. I would really encourage you to contact your primary care team again and schedule another appointment specifically to address your pain. And I would also like for you to leave your name at the end of the call so that I can look into your chart and follow up directly with you.
Thank you.
Thank you.
Thanks, Roy. Next question, Maria in Marengo, Illinois. Maria, go ahead with your question.
Hi, I'm just calling regarding women's health care. Will there ever be a gynecologist at the Rockford Clinic? I know that currently they do pap smears through the primary care and things like that, but specifically things that are more in-depth, perimenopause, menopause, just, other things, would that be ever available at Rockford? Because if we are sent in community care. There's very limited providers, and usually we only have about 1 to 2 appointments, and they don't address everything.
Hi, Maria. This is Erin Mullen again from Primary Care. Really appreciate your comments. I think that the world of women's health care is still kind of burgeoning, especially with the topics you spoke about, like perimenopause. We do not have a gynecologist available at the Rockford Clinic, and unfortunately do not foresee one coming there. There are several providers there that do women's health specific care, and we really try to provide a lot of educational opportunities for them to stay up to date on new information and kind of evolutions in care. And so we do have gynecologists available here in Madison. I realize that's quite an inconvenience and can be really difficult to make that trip. We could potentially set you up with an e-consult to talk with them more specifically if there are specific questions that you have. And again, if you'd like to leave your information at the end of the call, someone from primary care would be happy to follow up with you.
Okay, thank you. Appreciate it.
Thank you, Maria. Our next question, also unknown caller and unknown location.
No, that's the one I already did.
Oh, we already answered that one. I apologize. Thank you. Next, we are going to go to Bill in Milton. Bill in Milton, go ahead with your question.
Hi. I've got a question about Medicare Part B. I've seen advertisements on TV about if you're utilizing the VA for medications, that you can get reimbursed the Medicare Part B premiums that you pay once you turn 65. And I'm just wondering if that's true and how to find out. Thank you.
Hi, Bill. That's a really great question, and certainly this is Stephanie again in social work, if you haven't recognized my voice by now. But Medicare, Medicaid, medical assistance, TRICARE, all of those are really tricky programs that work somewhat together and somewhat independently. So I always recommend that people call the social work office and have their specific situation looked into. And if we can't answer your questions, we will typically refer you out to the local community aging and disability resource center, because they have a lot of, they have a position called a benefit specialist, who it really is their whole job to kind of look and see what works together and what doesn't. But certainly call the social work office, 608-280-7085, and we can get the basic information collected and hook you up with somebody who would be able to kind of look at your specifics and tell you what your options are.
All righty. Thank you very much. Appreciate it.
Thanks, Bill. Next up, we're going to Matt in Rockford. Matt in Rockford, go ahead with your question.
Yes, I attend 2 groups here in Rockford, in the Rockford area. I go to the Vet Center on Tuesdays, which is headed up with Chester Hollins, and I also attend a group on Wednesdays afternoons with Esteem and I'm sorry, I forgot the other guy's name, but I just wanted to ask, those groups for myself are very important, and I want to make sure that I'm checking to see if those groups are on any type of chopping block to be cut out, because for myself, just recently experiencing some mental health issues this past winter and spring, and the VA did step up, and once I addressed it, by going to the Rockford Clinic. Those groups have become very important to me, and I was just hoping that they don't get cut.
Hi, Matt. This is Athena from the Rockford VA Clinic. I'm glad to hear that you were able to get what you needed and that the groups were beneficial for you. We have no plans as of right now to cut those groups, so that's good news. I know Chester does a great job, as well as our group on Wednesday. That is also very well received, so we will not be changing them at those times. I just worked with mental health on those yesterday. So we're in the clear there. I also see that you love Nick and Dominique. I'm glad to hear that because they're super helpful, and I'm glad that you have such a great experience when you come to Rockford.
Yeah, they are definitely the first faces you see generally when you walk in there, and they're always extremely helpful, respectful. They've always stepped up whenever I've needed. And they don't know the answer, but they find out. So I appreciate that.
Thanks. I appreciate the feedback. I'll make sure they get out to know that they're well received. Thanks.
Thanks, Matt. Next, we're going to Loves Park, Illinois. Lee in Loves Park, you have a question.
Hello, veterans out there. I want to say I appreciate what you've done for this country. And another thing I'd like to say is kudos to the VA for what you do on a daily basis. This is kind of unrelated to your forum here, but the open house that you're going to have in Rockford, at the Rockford Clinic, I believe it starts at 11 till 2. I just want to let you know that I'm not going to attend that unless they have Johnsonville brats. Now, there's a reason for that, because that is the only brat that is really worth eating. So, just giving you a heads up on that. But all kidding aside, thank you all for what you're doing today.
Hi, Lee. This is Athena. Thank you so much for that feedback. I'll have to check. I do know that they're bringing a ton of brats. I'm hoping they're Johnsonville, too. I share your love for Johnsonville brats down in Illinois. So thank you for that, and we look forward to seeing you tomorrow.
Did not realize we were going to get brat opinions on the line today. Always welcome, though. All right. I think we've got time for at least one more. Let's go to Richard in Beloit. Richard in Beloit, you have a question.
Hello.
Hello.
Yes. My question is I have a cousin that's been taking care of me for almost 10 years, and she's applied for compensation. She does everything. She has a family of her own. She does not live with me. She's here just about every day, at least every other day. She fixes my meals. She basically does all my laundry. She gives me showers. I've had 11 heart attacks, 4 strokes. I live in my own house, and she's been denied payment for me, and I was wondering why she's been denied.
Hi, Richard. This is Stephanie from social work. That doesn't sound right to me, so there must be either a mistake or some criteria that isn't being met. So
well,
you
she was told that she didn't live with me. It was the first time. The second time, she was told that she didn't do enough. I rented it the first time that she was told that. I own my own house now.
Yeah, so I think we need to look into your specific situation. So at the end of the call, if you can leave your information. The other thing you can do is you can call the patient advocate's office and file an appeal or try to file an appeal about a decision that's being made about the care. And that extension is, the phone number is
Whoa, you're going to have to go slow. I will not do it very fast. I'm very slow at stuff. I do drive, but I'm very slow at doing stuff right down. I won't even remember half of this phone call.
Okay, then I think what you should do is leave your name at the end, and we'll call you back, and we'll look into your situation, okay?
Yes, ma'am.
And then there's another program that I think might be beneficial. So again, when you leave your name and number, we can look into that program too, called Veteran Directed Care. So let's get your name, and then we'll look into it. Thank you.
That's all the time we have for questions this afternoon. I see there are still a few people that had questions we were unable to get to. Please stay on the line, because in just a moment you'll have the opportunity to leave a voicemail with your questions, comments, or feedback. We will return every call. It sometimes may take a week or so to get back to you, depending on who needs the information and who needs to call you back. But we very much thank you for your service. Again, happy birthday to the Air Force tomorrow, and a special thank you for joining us today.